Hello, my name is Collewijn. I'm a physical therapist and I want to talk a little bit about back injuries today. Okay? Most people come to me and they ask, okay, I have a back injury, I complain about back pain, I'm bent and it hurts, or I wake up in the morning and I'm stiff, and people just always wondering what is it, what's the cause, why is this happening, but most importantly, what can they do about it? Okay, so I'm now addressing the various structures and functions you can lose or have lost that can cause some pain and discomfort. And then I recommend to you that you need to come and check it out so you can get a good plan and not just go on your own wild, because any activities that you don't do in the proper sequence will not contribute, and then you might give up. What I've seen so many times on, well, these exercises don't work, they didn't work in the past, but after you have recovered some functions, maybe these exercises will work perfectly. So that's the danger and the liability of going attacking your own back pain and you don't know the sequence or of how to address it or what exactly is wrong. So I'm going to go over some different aspects, what can go wrong with the body. Okay, so I'm going to use my little friend here, Skeleton, to give a little demonstrations. Okay, so we're talking about low back mainly, you know, even though this counts for every joint in the body really. But the low back, it has a normal curvature that goes a little bit in, which we call a lordosis. Okay, that causes the spine to have a little S curve. Now if this curvature isn't there, then we know, okay, that's not optimum. Alright, so now we have to go find out, is it because we have muscles that are attaching to these pelvic bones here, to make this go away a little bit. Alright, this is the pelvic bone and the ilium, okay, which sits to the sacrum. You know, most people have heard about the SI joint, this particular joint, and then you have the 5 lumbar spine vertebrae, which are the bodies of each individual vertebrae in the spine. And that's called lumbar, which means basically low back. Now, each of these joints have each of these vertebrae, have 2 joints on top, 2 joints on the bottom. Okay, now these joints could be displaced slightly, so they don't slide through the full range of motion. Well, that could be a cause why this curvature could be eliminated, okay, because you don't have the range of motion. Now, that could be caused because the ligaments of each of these joints, by the way, you have 20 of them over the bottom 5, as you can see, because you have 4, 2 on top and 2 on the bottom, you have 5 equals 20, right? You could have ligaments that are loose, and that makes a joint unstable. Now, ligaments will tell the muscles, which are laying deeply over here, and then you have the crow's muscles we all see in some of these good young bodies or physical trained people. You see the contour of the big gross muscles in the back that run like that, and they take care of your body. However, the lower and the deeper muscles also take care of the body. So what could it be? It could be a range of motion problem, then you have a structural problem, and you know, people go to chiropractors or physical therapists to resolve that. Okay? Then further, if that is resolved and you have now the full range of motion and you get some of that curvature coming back, how do you keep it back? Well, that's when you have to build or retrain the firmness, the tone of the muscles, which are in the front. And everybody heard many of times you have to train your core or your abdominal muscles to create kind of this muscle corset around your lower back. You're absolutely right. You first have to firm it up and make it work. After it's working, you have to now start saying, can I hold certain positions in my work activity or laying down, and it doesn't cause pain? And if it causes some pain or discomfort, there is still some inhibition taking place regarding holding up your proper posture or firmness of these muscles. Now, after having done that, now you have to make all these muscles, which is quite a miracle actually, if you think of it, working together. These hips work with the low back, the pelvic floor, which is the low back, abdominals with low back, and then you have your back muscles. Now all that needs to work in balance together so you have stability. Well, that might mean that one muscle is weak and then the other muscle takes over. So how do you balance that out? You need to figure that out and get a simple stretch or a simple coordination exercise will help you a lot with that. Now then you have the coordination handled, and then all you need to do is start conditioning. Now obviously the world is full of conditioning apparatus and machines, but you can take it at a too high of a level too fast, and the next thing you do is you hurt a muscle, now you have an injury, and the whole process starts all over again. So the body is complex, it sits together. We can simplify it by looking at the different purposes of structure, coordination, conditioning, and we have actually simplified it that even more with simpler and smaller steps, so you can really identify where the injury is coming from. Knowing that step, you can actually start your program in the rehab and recovering the function, which will ultimately lead to you not having any discomfort, because smooth function basically means that there is no reason for having any pain. Okay? So those are some of the common main factors you have to look at. So what I recommend you do, wherever you are, go get it examined. Go find out if it is a structural thing, mobility thing. Go find out if it is a muscular thing in the form of muscle tone, posture, flexibility, or or it's just a balancing, or is it just lack of conditioning? Okay? Find out that way and start on a program that really bring you upwards and not bring you down. Okay? Good luck with that. I hope that was helpful, and I'll see you soon. Bye.